You come 31.
Cerebrovascular diseases are brain disorders which are caused by pathologic processes involving blood vessels. Cerebrovascular diseases are one of the top 3 causes of death. This section is the absolutely must-know section of neurology. You have to know this section. It is a must. You should not walk into the exam without knowing cerebrovascular diseases. So cerebrovascular diseases, these are brain disorders. They're quite common. And as I said, one of the top 3 causes of death. Cerebrovascular diseases are the brain disorders which are caused by pathologic processes involving blood vessels. باختصار, these are disorders which happen in the brain. سببها problems with the blood vessels. إما occlusion of a blood vessel by embolic occlusion, إما thrombotic occlusion بالبلاد vessel أو vascular rupture بالبلاد vessel. هذه عادة تنطينا signs and symptoms. يعني هاي الحالة cerebrovascular diseases اللي هي pathological processes happening in the brain, سببها interruption بالبلاد supply, سببها bleeding, سببها embolic occlusion, سببها thrombotic occlusion. هذه كلها clinically the most frequent clinical manifestation مالتها هو الستروك. يعني pathological process تصير بالبرين سببها vascular problem. أهم clinical manifestation لهاي الحالة هو الستروك اللي هي جلطات الدماغ. The most frequent clinical manifestation of cerebrovascular diseases هو الستروك. إن stroke is the most frequent clinical manifestation of cerebrovascular diseases. يعني من الإنسان من الشخص يصير عنده cerebrovascular disease نتيجة vascular rupture, نتيجة thrombotic occlusion, نتيجة embolic occlusion. حفظوهن إما vascular rupture أو thrombotic occlusion أو embolic occlusion. من يصير هالشي بالبرين عادة البيشنت يجينا with features of stroke. pathological problem بالبرين بالvessels مالت البرين تنعكس على clinical features عند البيشنت اسمها stroke. فشنو الستروك؟ It is the clinical term that refers to infarction or bleeding into the brain. Manifests with شنو يجي البيشنت sudden onset of focal neurological signs lasting more than 24 hours. Sudden onset of focal neurological signs lasting more than 24 hours. Sudden onset of focal neurological signs يعني شنو؟ Sudden onset of weakness, sudden onset of paresthesia, sudden onset of weakness and paresthesia, sudden onset of dysarthria يعني difficulty to speak, sudden onset of confusion. هاي كلها sudden onset of focal neurological sign. ويقولون عليها focal neurological sign لأنه راح يؤدي neurological symptoms سببها focal area of the brain being affected. فإذا sudden onset of focal neurological signs. focal neurological signs يعني neurological signs في مكان محدد. weakness في مكان معين, numbness في مكان معين, ataxia مثلا. بس كلها سببها فتفوكس بالبرين صار بيها interruption بالبلاد سبلاي مالتها إما نتيجة vascular rupture, embolic occlusion, thrombotic occlusion. وهذه symptoms lasted more than 24 hours. عند ذلك we will say this is stroke. It's so common that someone in the United Kingdom has a stroke every 3.5 minutes. كل 3 دقائق ونص أكو واحد يصير عنده stroke بالUnited Kingdom. The clinical term stroke refers to the sudden onset of localized neurological deficit lasting more than 24 hours. So sudden onset, suddenly فجأة يجي البيشنت فجأة صار عنده weakness, فجأة صار عنده numbness, فجأة صار عنده paresthesia, فجأة صار عنده ataxia, فجأة صار عنده weakness و paresthesia هيجي. It's a sudden onset of localized neurological deficit. And by localized I mean it's a certain area of the brain being affected by the vascular insult, and consequently neurological symptoms which are related to that specific area of the brain will appear. These symptoms last for more than 24 hours. Thrombosis and embolism both have similar consequences for the brain. سواء عندي thrombosis أو embolism اثنيناتهم راح يسووا لي interruption of blood supply to a specific area of the brain. Both of them will lead to loss of oxygen, metabolic substrates for the region supplied by the affected vessel. وبالنتيجة هاي region which is supplied by that affected vessel حتتأثر، حيصير بيها ischemia، راح تموت. ف this will result in infarction or ischemic injury لهاي المنطقة. and as a result المكان من الجسم اللي هذا الجزء من البرين مسؤول عنه، مثل ما قلنا سابقا stroke is the most frequent clinical manifestation of diseases of the cerebral blood flow. يعني عندي diseases تصير بالcerebral blood flow تنعكس clinically سريريا على البيشنت، عادة تنعكس على البيشنت. it will be reflected هذه cerebrovascular diseases it will be reflected clinically as stroke عادة. however sometimes cerebral blood vessels من يصير بها مشكلة يصير بها diseases ممكن تنطينا dementia in elderly عادة. فdementia in elderly عادة سببها cerebrovascular diseases. بس فيما عدا ذلك أغلب cerebrovascular diseases will be manifested as stroke. So what is stroke? Sudden onset of symptoms. لازم تحفظوها. Sudden onset of symptoms تطلع suddenly. شنو? Focal involvement of the CNS. This is suggested by the symptoms and signs اللي هي symptoms and signs related للمكان of the brain that is supplied by this blood vessel. This is suggested by the symptoms and signs and confirmed by imaging studies. It will be confirmed by CT scan or MRI to the brain. The symptoms and signs should be referable to the territory of a particular cerebral blood vessel, which is يعني شنو the blood vessel that is affected. فالبلاد vessel اللي هو affected شوف يا منطقة بالبرين هو مسؤول عنها، فالساينز والسيمتومز راح تطلع على هالأساس، على أساس المنطقة which is affected from the brain. The classic definition of stroke requires the deficit to persist for at least 24 hours. This is important to distinguish stroke from transient ischemic attack. And when this is confirmed, when stroke is confirmed by imaging studies, مثلا CT scan or MRI to confirm stroke, يجينا البيشنت sudden onset of right lower limb weakness, sudden onset of weakness and paresthesia left lower limb, sudden onset of dysarthria and difficulty to speak, sudden onset of dysphagia إلى آخره, sudden onset of loss of vision وإلى آخره من sudden onset of focal neurological deficits. يجينا المريض راح أشك عنده stroke أسوي له CT scan or MRI to the brain حتى أشوف ال area of the brain that is affected. When this is confirmed, when stroke is confirmed by imaging studies, further investigations will be required. يعني أنا ورا ما أتأكد إنه هذا البيشنت عنده stroke من خلال CT scan أو MRI to the brain، الستيب اللي بعدها لازم أشوف شنو السبب هذه الاريا to be affected، ليش تأثرت؟ هل أنا عندي arterial thrombosis؟ هل أنا عندي cardiogenic embolus؟ هل أنا عندي clotting disorders؟ مثلا أجي أسوي echocardiogram to exclude clot as a source of embolus. أسوي مثلا echocardiogram للقلب حتى أشوف أكو clot within the heart ومن الكلوت طفرت عندي embolus راحت للبرين. مثلا أسوي ECG للبيشنت أشوف عنده atrial fibrillation، ممكن يكون عنده atrial fibrillation وهي هاي سبب interruption of blood supply to the brain، لأنه atrial fibrillation ممكن حتاخذوها بعدين بصف رابع القلب ما يضخ بشكل جيد فيبقى الدم باقي بالقلب فترة يصير عندي clot within the heart. From this clot an embolus might travel to the brain. Okay, carotid Doppler ultrasound. This can exclude narrowing of the carotid. Carotid arteries ممكن يصير بيها narrowing، وإذا صار عندي narrowing بالcarotid arteries because of atherosclerosis بالcarotids فيصير بيهم narrowing. إذا صارت narrow والnarrowing مالتها more than 70% والpatient عنده symptoms of stroke، بهالحالة لازم أسوي له end arterectomy، carotid end arterectomy، عملية يفتحون الcarotid artery وينظف. So stroke is very important. وهذا موضوع مهم جدا بالامتحان مالتكم. It is the fourth leading cause of death in the United States. في بعض الدول it is the third it's one of the top 3 causes of death in بعض countries, وبال United States it's the 4th leading cause of death in the United States following heart diseases, cancer, chronic lung diseases. stroke يأتي رابعا ضمن the causes of death. So what are the risk factors of stroke? There are 2 groups of risk factors, modifiable and non-modifiable. The non-modifiable risk factors are the risk factors that you cannot change. The patient cannot change them, like his age, being male, having a family history of stroke. These are non-modifiable risk factors. On the other hand, there are modifiable risk factors. اللي هم risk factors that the patient can change them, can control them, like hypertension, smoking, diabetes. These are the most important ones. Don't come into the exam without knowing those ones. Hypertension, smoking, diabetes, dyslipidemia, and obesity. These are the most important ones within that list. Hypertension, diabetes, obesity, and dyslipidemia. Smoking. Hypertension, diabetes, obesity, dyslipidemia, and smoking. Hypertension, diabetes, dyslipidemia, obesity, and smoking. These are the most important ones. In addition, of course, there is atrial fibrillation, congestive heart failure, ischemic heart disease. Stroke usually produces focal symptoms and signs that correlate with the area of the brain supplied by the affected blood vessel, as I said. So stroke can be ischemic in 90% of the cases or hemorrhagic. مو قلنا الستروك عادة سببها cerebrovascular problem. هاي cerebrovascular problem هي ischemia in 90% of the cases, hemorrhage in 10% of the cases. فإن ischemic stroke, occlusion of a blood vessel interrupts the blood flow to a specific region of the brain, leading to loss of the neurological functions dependent on that region. هذا ischemic stroke. بالhemorrhagic, it produces less pattern of focal involvement. هو راح يصير عندي focal involvement بس less pattern of focal. الفوكاليتي أقل من حيث السيمبتومز. ليش؟ لأنه من يصير عندي hemorrhage عادة أكو big area of edema، وعندي راح يصير increase intracranial pressure، وراح يصير عندي compression of the brain tissue. هذه كلها تنطيني more signs and symptoms إضافة للfocal signs and symptoms. فبالإسكيميك stroke عندي signs and symptoms related to loss of neurological function dependent on that specific region of the brain. هذا بالإسكيميك. بس بالهيموراجيك السيمتومز أكثر تطلع، لأنه blood راح يمشي يعني بالcranial cavity، فراح يزيد لي الانتراكرينال pressure، حيسوي لي cerebral edema، حيصير عندي compression of brain tissue. اوكي؟ فلذلك السيمتومز تكون less focal بحالة الهemorrhage. So these complications can impair brain function at sites removed from the site of the hemorrhage. Ischemic stroke, more common than hemorrhagic. Ischemic 90% of the cases, hemorrhagic 10%. Ischemic can involve large artery thrombosis or embolus into a large artery, small artery thrombosis or embolus into a small artery, emboli, vascular dissection is uncommon, systemic hypotension. Systemic hypotension شنو؟ Sometimes the patient will have systemic hypotension، ينزل blood pressure عند البيشنت بحيث البلد سبلاي عن البرين ككل يقل، فهم يصير عنده stroke نتيجة systemic hypotension. blood pressure قليل جدا بحيث البلد سبلاي للبرين ككل يكون قليل، فيصير عنده stroke. هذه حالة. وأكو حالة large artery occlusion by a thrombus or embolus, small artery occlusion by a thrombus or embolus. Where, as I said, ischemia is more common than hemorrhage. بالمناسبة when I say systemic hypotension، إذا patient عمره 60 سنة صار عنده systemic hypotension compared to شخص عمره 20 سنة يصير عنده systemic hypotension، أكيد اللي عمره 60 سنة حيتأثر أكثر. ليش؟ لأنه he already has narrowed arteries within the brain بسبب عمره. لأن بتقدم العمر يصير narrowing للarteries. فاللي عمره 60 سنة وزاد systemic hypotension he is more likely to develop stroke compared to a young patient, a 20-year-old patient with systemic hypotension. أما الهemorrhage فعادة يصير نتيجة hypertension أو نتيجة trauma أو نتيجة overzealous anticoagulation. يعني patient دا يأخذ هواية anticoagulant. يعني مثلا patient يأخذ warfarin, overdose of anticoagulant, overdose of warfarin ممكن يسبب له hemorrhagic. من حكينا على الستروك قلنا there will be sudden onset of focal neurological deficit. فexamples من الclinical features اللي نشوفها ممكن يصير sudden onset of numbness or weakness of the face, arm or leg, especially on one side of the body. ممكن يصير sudden confusion or inability to speak. ممكن يصير sudden problem in seeing in one or both eyes. So stroke versus TIA. Both of them sudden in onset. Both of them focal neurological deficit. الفرق هو أنه stroke usually lasts more than 24 hours. Transient ischemic attacks من اسمها transient they last less than 24 hours. عادة transient ischemic attacks سببها transient embolization. embolus معينة تصعد تروح للcerebral arteries أو their small branches وتسد الارتري for a while أقل من 24 hours وتروح الامبولس ويروح السيمتومز وياها. بس هذول at risk of developing stroke in the future. صحيح ان البيشنت اذا اجانا with symptoms of stroke with sudden neurological deficit, sudden focal neurological symptoms lasting less than 24 hours. I'm saying less. صحيح هذا TIA واختفت بس اقول للبيشنت you have to be careful. محتمل تتكرر عندك هاي الحالة. هم اسوي له investigations اشوف ليش صارت عنده. Although hypoglycemia and other metabolic disturbances, trauma and seizures can produce focal central neurologic deficits that begin abruptly, يعني suddenly, and last for at least 24 hours, the term stroke is used only when such events are caused by vascular diseases. واضح؟ يعني على الرغم من أنه الهايبوغلايسيميا some metabolic disturbances ممكن trauma ممكن seizures تنطينا focal neurological deficit ويطول more than 24 hours بس هذه كلها ما دام سببها not vascular ما نسميها stroke. على الرغم من أنه ممكن التعريف يتحقق sudden onset of focal neurological deficit lasting more than 24 hours. تصير هذه ممكن بالهايبوغلايسيميا بالميتابوليك disturbances بالتروما بالسيجر لكن هذه ما نعتبرها stroke لأنه البروبلم is not because of vascular disease. The underlying pathologic process in stroke can be either ischemia or hemorrhage, usually arising from an arterial lesion. قلناها. Therefore, after diagnosing stroke, the patient will need to have cardiac echocardiogram حتى نشوف إذا أكو clot within the heart, ECG أسوي للهارت أشوف إذا عنده atrial fibrillation, أسوي carotid doppler يعني نفحص الكاروتيد arteries إذا صار بيها narrowing صار بيها atherosclerosis لأنه هاي كلها تعتبر أسباب للستروك حتى نعالج السبب. ملاحظة صغيرة brain edema is another determinant of the symptoms. يعني احنا مو قلنا يصير sudden onset of focal neurological deficit lasting more than 24 hours. مرات تطلع عندنا symptoms إضافية بسبب brain edema. This happens because fluid leaks from the intravascular compartment into the brain parenchyma. And edema is usually maximal approximately 2 to 3 days after stroke and may be sufficiently severe that it produces a mass effect, pressure effect that causes herniation, displacement of the brain tissue between intracranial compartments and death. فمرات الإديمة is severe بحيث تسوي لي pressure effect وعادة the maximum الإديمة توصلها within 2 to 3 days after stroke. يعني ورا week after 1 week from stroke تكون الإديمة قلانة كلش. اوكي توصل أكبر حجم الإديمة. طبعا الإديمة ممكن يصير بالإسكيميك وممكن يصير بالهيموراجيك both of them. والماكسيمم الإديمة maximum size of edema will be within 2 to 3 days after stroke. عادة الجسم عادة عندنا دائما اكو compensatory mechanisms اكو collateral circulation arteries أخرى الله سبحانه وتعالى خالقها حتى تيجي تعوض إذا صار عندي ستروك في مكان ما. لذلك بعض البيشنتس اللي عندهم ستروك يتحسنون ورا فترة على الرغم من هو عنده arterial occlusion arterial occlusion بس تحسن. ليش؟ لأنه اكو other collateral circulation و other arteries جت عوضت وزودت المكان من البرين. So the first line defense against ischemia is collateral circulation, which if adequate إذا كانت adequate can bypass an arterial occlusion. The cerebral circulation contains numerous collateral pathways, accounting for the observation that patients with total occlusion of a major vessel are sometimes asymptomatic. ليش؟ Patients with total occlusion of a major vessel are sometimes asymptomatic. ليش؟ لأنه عندنا good collateral circulation. However, this is not always the case. However, أحيانا ما تكون الكولاترال كافية enough وتغطي المكان enough بحيث يصير البيشنت asymptomatic. لا، ممكن partially يتحسن المريض بسبب الكولاترال circulation، وهو هذا أغلب الأحيان هو شوية يصير تحسن بسبب الكولاترال circulation. Mechanisms of cerebral ischemia احنا قلنا in general إما يصير عندي thrombosis أو embolic occlusion. Both of them نسميها ischemic stroke وأكو hemorrhagic stroke. So for ischemic stroke عادة عندي for ischemic stroke إما large vessel occlusion ينسد بالatherosclerosis or embolism أو small vessel occlusion عادة atherosclerosis and also ممكن embolism. بس الامبوليزم usually emboli happens in the large vessels. Okay, emboli usually نشوفها بالlarge vessels، ممكن هم تصير بالsmall vessels. يعني انتم مو لا كلش تتعبون نفسكم بهذا السلايد، هو نفس الكلام السابق. الخلاصة هي cerebrovascular diseases ممكن تصير نتيجة thrombosis أو نتيجة embolism. اوكي، أحيانا مثل ما قلنا systemic hypotension مثلا أو cardiac arrest هم نفس الفكرة، هم global ischemia هم systemic hypotension راح يصير نتيجة cardiac arrest. يعني systemic hypotension و cardiac arrest هم اثنيناتهم ايش راح يسوون؟ يقل blood supply to the whole brain. قلنا عليها هذه generalized poor perfusion of the brain. اوكي، ونرجع عندنا large vessel occlusion small vessel occlusion. سواء large أو small إما تنسد بالأثيروسكليروسيس أو تنسد بالإمبولس، ولكن الإمبوليزم أكثر شيء يأثر على large vessels. مو مهم هاي التفاصيل يعني كلش. Thrombosis usually produces stroke by occluding large cerebral arteries مثل internal carotid, middle cerebral or basilar، أو by occluding small penetrating arteries as in lacunar stroke. اكو نوع من انواع الستروك اسمها lacunar stroke سببها occlusion of small penetrating arteries، راح تجينا بعد شوية. والsymptoms بسبب الثرومبوسيس عادة evolve over minutes to hours. Embolism produces stroke when cerebral arteries are occluded by the distal passage of thrombus from the heart. thrombus تجي من الهارت وتروح distally to the brain أو من الكاروتيدز وتصعد فوق. Emboli in the anterior cerebral circulation، إذا الإمبولا صعدت بالanterior cerebral circulation most commonly it will occlude the middle cerebral artery. تدرون أنتوا أكو anterior cerebral وأكو posterior cerebral circulation. anterior cerebral circulation عادة الارتري اللي هو most commonly occluded هو middle cerebral artery or its branches, because most of the hemispheric blood flow is through this vessel. And usually patients who present with a past usually patients اللي صاير عندهم embolism usually من تاخذ منهم history راح يقول لكم they presented in the past. بالpast medical history راح تسمع هواية عندهم repeated TIAs transient ischemic attacks، لأنه ال TIAs عادة سببها emboli because emboli tend to happen frequently. global ischemic encephalopathy. global ischemic encephalopathy هذه اللي قلنا عليها شنو؟ ببساطة global affection of the brain. كل البرين will be affected by hypoperfusion مثلا نتيجة cardiac arrest, systemic hypotension. This will result from generalized poor perfusion of the brain. Area most commonly affected by global ischemia منو؟ arterial border zone areas. اكو border zones بالبرين هذه most commonly affected by global hypoperfusion. هي المكانات اللي تصير هيك حافات الديستريبيوشن اواخر الارتريز border zone areas regions between the distribution of cerebral arteries يسموها watershed infarcts. هذا النوع من الانفاكشن يسموه border zone infarction او يسموه watershed infarction. An example of watershed تكلمنا عن ischemic stroke قلنا الثرومبوسيس وين ممكن يصير وقلنا الامبولاي وين ممكن يصير. هسه نجي على الهيموراجيك stroke. Hemorrhage may produce symptoms through a variety of mechanisms. تتذكرون قلنا الهيموريج من يصير symptoms راح تطلع لنا less focal than ischemia. ليش؟ لأنه عندنا الsymptoms راح تصير بسبب interruption of blood supply to a specific area of the brain. interruption of blood supply to a specific area of the brain. عندي focal symptoms. In addition هسه عندي edema. In addition البلاد راح يصير be leaking to the subarachnoid space وراح ينطيني more symptoms due to irritation of areas of the brain remote from the site of the main problem. So intracranial hemorrhage can be classified into انتبهوا intracranial يعني كلها داخل السكال. intracranial ممكن نقسمها إلى intracerebral, subarachnoid, subdural, epidural. كلهم ما عدا subdural hemorrhage are usually caused by arterial bleeding. كلها سببها arterial bleeding ما عدا subdural. هنا بالهemorrhagic stroke اللي هي intracerebral hemorrhage هو أول نوع من أنواع intracranial hemorrhage. أول نوع من أنواع الهemorrhagic stroke intracerebral hemorrhage. It causes symptoms by destroying or compressing the brain tissue. So it's unlike ischemic stroke. الانتراcerebral hemorrhage يصير بيها more severe headache and more tendency for the consciousness to disappear. Depression of consciousness أكثر, more severe headache أكثر بالintracerebral hemorrhage مقارنة بالإسكيميك. هاي الأنواع اللي أخذناها قبل اللي هي ثرومبوسيس أو occlusion اللي سببها إسكيميا. الإسكيميك ستروك اللي سببها occlusion وثرومبوسيس هناك الهيدك أقل, depression of consciousness أقل. هنا بالintracerebral hemorrhage more headache, more depression of consciousness. In addition, neurological deficits هنا neurological deficit does not correspond to the distribution of any single blood vessel. The neurological deficit does not correspond to the distribution of any single blood vessel. ليش؟ لأنه مثل ما قلنا حيصير عندنا neurological deficit سببه interruption of blood supply to a specific area of the brain. زائدا brain edema. زائدا increase intracranial pressure. زائدا البلاد هذا راح يصير بيه oozing ويروح للسباراكنويد سبيس ويسوي لنا مشاكل أخرى. The most common cause of spontaneous intracerebral hemorrhage is hypertension. ممكن يسوي نزف بالدماغ. ارتفاع الضغط acute severe hypertension ممكن يسوي نزف بالدماغ. The most common location is the basal ganglia. عادة هذا يصير بالباسal ganglia مثل ما تشوفون بالصورة. The underlying vascular pathology is arteriosclerosis. ممكن يكون عندي arteriosclerosis بالبلاد vessel. On the top of that إجالي severe hypertension سبب لي intracerebral hemorrhage. يعني rupture of the blood vessel with intracerebral hemorrhage عادة نشوفها بالباسal ganglia. So we have discussed intracerebral hemorrhage. Now we are discussing the subarachnoid hemorrhage. Subarachnoid hemorrhage leads to cerebral dysfunction and symptoms due to increased intracranial pressure, resulting in pressure effect on the blood vessels, leading to hypoperfusion and loss of consciousness. Basically, what's happening here is that bleeding within the subarachnoid space will result in increase in the intracranial pressure, because the artery keeps bleeding and oozing within the closed space within the cranium, so there will be increased intracranial pressure. This high pressure can lead to occlusion of arteries, leading to hypoperfusion of the brain and loss of consciousness. Subarachnoid hemorrhage usually results from a ruptured cerebral arterial aneurysm, perianeurysm, or ruptured AV malformation. Other congenital anomalies like polycystic kidney disease or coarctation of aorta may be associated with perianeurysms. So patients with, this is an important question for USMLE for PLAB exam. Patient with polycystic kidney disease presented with sudden onset of headache, loss of consciousness, you have to think about subarachnoid hemorrhage, because polycystic kidney diseases are usually associated with perianeurysms. Patient known to have coarctation of aorta presented with sudden onset of severe headache, photophobia, vomiting, loss of consciousness. رأسا نفكر بالسباراكنويد hemorrhage، لأنه البيشنت اللي عنده coarctation of aorta أو البيشنت اللي عنده polycystic kidney disease هذول الاثنيناتهم more likely to develop subarachnoid hemorrhage لأنه عندهم perianeurysms عادة. So subarachnoid hemorrhage typically presents with headache, the worst headache the patient has ever had. The patient will come and say, look doctor, I have headache and it is the worst headache I've ever had. ممكن يكون عندنا in addition to that severe headache meningeal irritation signs like neck stiffness، وممكن يكون البيشنت عنده أيضا photophobia and vomiting, sometimes loss of consciousness. Perianeurysm can rupture at any time. In 1/3 of cases, it is associated with an acute increase in the intracranial pressure. So, people with perianeurysm should avoid having an acute increase in the intracranial pressure. This acute increase in intracranial pressure can happen with straining in the toilet. It can happen during intercourse. It can happen with weightlifting. So these conditions are associated with a higher risk for rupture of their perianeurysm. So they should be careful. The patient will have sudden severe headache and rapid loss of consciousness, vomiting, photophobia, meningeal irritation signs. Now the other type of intracranial hemorrhage is subdural or epidural hemorrhage. Both of these types of hemorrhage, they can produce a mass lesion, a mass effect. اكو تعبير يستخدموه بالنيورولوجي يقولون mass effect، يعني هذا البلد راح يتجمع ويسوي لي تأثيرات pressure، يسموها mass effect، يعني كأنما mass موجودة ودا تضغط somewhere، يسموها mass effect. So هذا البلد راح يتجمع ويسوي لي mass effect، mass lesion، symptoms and signs because of pressure effect. It can compress the underlying brain. هذا البلد اللي راح يتجمع عندي subdural أو epidural حيسوي لي pressure on ضغط على البرين pressure. It will compress the underlying brain. These hemorrhages are often traumatic in origin and usually present with headache or altered consciousness. Headache or disturbed consciousness following trauma. حفظوها headache or disturbed consciousness following head trauma. You have to think about subdural or epidural hemorrhage. Subdural or epidural hemorrhage. السبديورال hemorrhage هذا اللي هو هذا الأبيض بالصورة اللي من subdural hemorrhage، هذا الأبيض اللي على شكل موزة، الأبيض الطويل اللي بالبريفري هذا subdural hemorrhage، يطلع على شكل هلال على شكل موزة subdural hemorrhage. والسبديورال hemorrhage وين يصير bleeding between arachnoid matter and the dura matter. subdural جوا الديورا ماتر اوكي، جوا الديورا ماتر subdural ويكون شكله على شكل موزة. بينما الابيديورال أو إلى اسم ثاني اكسترا ديورال هو خارج الديورال ماتر، خارج الديورال ماتر ويصير شكله مثل هاي الليمونة elliptical in shape. Lacunar stroke is an example of small artery occlusion. They develop over hours to days. Many lacunar infarcts are not recognized clinically and are detected only as an incidental findings on imaging studies. أحيانا يصير عندي occlusion of a very small artery, a very small blood vessel. Okay? وهذا الارتري الصغير كلش is supplying an area of the brain, مثلا an area in the white matter of the brain, واللي هي ما بيها clinical features واضحة على المريض. تصير هذه هواية، ممكن تصير هذه متكررة. فالبيشنت صدفة لما يسوي له MRI هو ما عنده symptoms، يقول عنده previous lacunar infarct، خصوصا عند المرضى اللي عندهم hypertension. However مرات هذه lacunar infarct على صغرها although it's small لكن تسبب لي symptoms وهسه راح تجينا. Small vessel occlusion can affect penetrating arteries deep in the brain, and they may cause infarcts in the putamen, or less commonly in the thalamus, caudate nucleus, pons, posterior limb of the internal capsule, or other sites. فإذا صارت بالinternal capsule، هي internal capsule شنو؟ fibers. فإذا صارت بالinternal capsule هذه الnerve fibers راح تتأثر وتطلع عندي clinical features accordingly. The patient may be asymptomatic بالlacunar infarcts. قلنا لأنه بعض lacunar infarcts تكون صغيرة ويكون المكان اللي صارت به it's a certain place in the brain, certain site of the brain, certain location of the brain which has no significant clinical outcome. ممكن يصير بيها lacunar infarcts وما يحس البيشنت. فتكون asymptomatic or the patient might have headache without impaired consciousness. In other cases, however, they produce distinctive clinical syndromes depending on their site in the brain. For example, اكو patients عندهم pure motor hemiparesis. This consists of hemiparesis hemiparesis affecting the face, arm and leg. Okay? Hemiparesis affecting the face, arm and leg. تعرف لي equal extents، يعني الفيس والarm والleg متأثرين بطريقة متشابهة بالseverity without associated disturbance of sensation, vision or language. هذه it's a lacunar infarct. Lacunes that produce this syndrome are usually located in the contralateral internal capsule or pons. إذا صار عندي occlusion بالanterior cerebral artery. Anterior cerebral artery supplies the anterior part of the brain. So if this artery is occluded by thrombus or by embolus أو by hemorrhage، إيش راح يصير عندي؟ Anterior cerebral artery supplies the anterior part of the brain. Okay? Frontal lobe, which is responsible for the personality. It is responsible for me, my personality, my thoughts, my behavior. كلها راح تتأثر. Personality, thoughts, behavior تتأثر بالanterior cerebral artery occlusion. So the patient will be confused. In addition, the patient will have lower limb weakness. Okay? So the patient will have lower limb weakness. فinstead he will not be able to move his lower limbs, but he's able to pee. He's not able to move his lower limbs, but he's able to pee. So he's incontinent. Patient unable to move his lower limbs, but he's incontinent. Confused, behavioral problems, unable to move his lower limbs, and incontinent. عادة these are the features of anterior cerebral artery occlusion. It's very, very important to know how to manage a patient with stroke. السيناريو المعتاد البيشنت حيخابركم أقرباء لا سمح الله اسم الله على قرايبكم، جيران، أصدقاء، فجأة بالليل الصبح يخابر دكتور أشو هذا أبوي أشو جدي، فجأة loss of sensation and loss of motor control, sudden weakness بالleg، فجأة رجله ما تشيله، فجأة ايده ما يقدر يحركها، صار شلل، فجأة وجهه، حلقه، لسانه انعوج، هالكلام هاي التعابير اللي تسمعوها هذه كلها indicates sudden onset of focal neurological signs. هنا لازم بسرعة يروح للمستشفى وبسرعة يسوي سي تي سكان حتى أشوف أنه هو ما عنده hemorrhage. إذا بسرعة سويت له سي تي سكان within 3 hours لحقت أسوي له سي تي سكان وتأكدت أنه السبب is not hemorrhagic. احنا قلنا 90% of cases هي ischemic. 90% of cases هي ischemic. إذا لحقت عليه within the first 3 hours أنطيه TPA tissue plasminogen activator. اوكي TPA انطي، راح اسوي له ثرومبوليسيس. هاي الثرومبوس اللي صارت عنده او الامبوليس اللي عنده راح اموعها ثرومبوليسيس within the first 3 hours. اذا لحقت عليه within the first 3 hours راح انطيه thrombolytic therapy. فلذلك العجله والاستعجال جدا جدا مهم. بسرعه يروح المستشفى، بسرعه يسوي سي تي سكان حتى اتاكد ما عنده هيموريج. اذا سي تي سكان قال لي ما عنده هيموريج، لان الهيموريج راسا يبين بالسي تي سكان. hemorrhage appears immediately on CT scan. Hemorrhage appears immediately on CT scan. So if CT scan is done and there is no hemorrhage, then within 30 hours we have to give him thrombolytic therapy, thrombolysis. If it's more than 3 hours and no bleeding وصار له على الsymptoms more than 3 hours أنطي للpatient aspirin. وإذا هو كان already on aspirin أنطيه clopidogrel. So giant cell arteritis, or it is called temporal arteritis, this is a form of vasculitis, inflammation of the blood vessel. So it is a form of vasculitis, small vessel disease, inflammation of blood vessel, small vessel disease, vasculitis. So giant cell arteritis, it produces inflammatory changes that affect branches of the external carotid artery, cervical internal carotid, or other intracranial arteries. It is common in elderly. This is very, very important statement. It is common in elderly and manifested as headache. So an elderly person who is 60 years old presented with acute onset of headache associated with transient monocular blindness, or associated with temporal artery tenderness, or associated with scalp pain, especially when combing the hair, or associated with jaw claudication. These are all symptoms of temporal arteritis. What I want you to know is never miss a patient who is an elderly with acute onset of headache that is associated with any of those, associated with either blood vision or visual problems, associated with temporal artery tenderness, or associated with scalp pain, especially when combing the hair, or associated with jaw claudication. These are very important symptoms of giant cell arteritis. The reason why I don't want you to miss a patient with giant cell arteritis, because these symptoms may develop blindness. These patients may develop blindness, but blindness is reversible if it was diagnosed early and treated with steroids early. So remember the role of 60. Patients ages 60 treated with 60 milligrams of prednisolone. How to diagnose the case? ESR more than 60. ESR more than 60. So patient is 60 years old because it's common elderly, new onset of headache, ESR more than 60, then the treatment should be prompt administration of 60 milligrams of prednisolone in order to save the vision of this patient. What I want you to know is that although the definitive diagnosis by temporal artery biopsy, basically you don't wait for the temporal artery biopsy results, you have to treat immediately with 60 milligrams prednisolone, because the condition might progress to irreversible blindness, because the patient may develop irreversible blindness. That's why you should not wait. You do not wait for the result of the biopsy. You have to give 60 milligrams prednisolone immediately once you see the patient who has new onset of headache, 6 years old, ESR more than 60, give 60 milligrams of prednisolone. The other thing is that although the definitive diagnosis by temporal artery biopsy, this disease tends to have skip lesions. This disease tends to have skip lesions. By skip lesions, I mean not the whole temporal artery is inflamed. Patches of the temporal artery are inflamed. So you might easily take a biopsy and the biopsy is negative because the inflammation might be somewhere else in the temporal artery, because this disease, as I said, has skip lesions. That's why definitive diagnosis by biopsy. However, negative biopsy does not exclude the diagnosis. Negative biopsy does not exclude the diagnosis. خلصنا cerebrovascular diseases. هسه نيجي نحكي عن الدي. راح نحكي عن الدي myelinating disease. أهمها هو multiple sclerosis. It is defined clinically by the involvement of different parts of the CNS at different times. لذلك اسمه multiple different parts at different times. يعني شنو؟ يجي البيشنت عنده weakness، وراها يختفي الويكنس، ورا شهرين يرجع weakness، يختفي ورا 3 أشهر يرجع weakness again. ببساطة هيجي. It's characterized by involvement of different parts of the CNS at different times. Different parts of the CNS at different times. يصير عندنا neurological symptoms وتختفي. ورا شهر ترجع. Neurological symptoms وتختفي. ورا شهرين يرجع. Neurological symptoms تختفي. فإذا هي neurological symptoms that happen in different parts of the CNS and at different times. من أقول different parts يعني مرة weakness، مرة ممكن يكون paresthesia، مرة يكون عندي bladder dysfunction، مرة يكون عندي visual problem. هاي كلها neurological symptoms. تطلع مرة تختفي وتطلع مرة ثانية، ومن تطلع مرة ثانية ممكن تتغير. يعني weakness muscle weakness راح، ورا شهر صار عندي visual problem راحت، ورا شهر صار عندي paresthesia. او ممكن نفس ال neurological symptom نفسه يتغير. بس in general عندي different parts of the CNS affected at different times. So the patient usually present with motor or sensory or visual symptoms. Then after a period of time these symptoms will disappear, then they will appear again. هذا اسمه multiple sclerosis. فهو هذا يعني as simple as that. Different parts of the CNS at different times. So patients can present initially with any of a variety of symptoms. Common initial symptoms ممكن تكون focal weakness. The most common ones: focal weakness, sudden loss or blurring of vision in one eye يسموها optic neuritis، أو bladder dysfunction. بس هذه symptoms will disappear and come back again. They are relapsing. The pattern of disease will differ from patient to patient. Most of the patients, 85% of the patients, will follow the relapsing remitting course. Relapsing, remitting, relapsing, remitting. Symptoms get worse, then get better, then get worse, then get better, then get worse, then get better. فالبيشنت صار عنده symptoms، صار عنده weakness، يختفي الويكنس، بس شنو يبقى شوية. ورا شهرين رجع الويكنس عنده، صار كلش ويك، اختفى. ما يختفي تماما، يبقى شوية عنده residual weakness. ورا شهرين رجع الويكنس again واختفى، يبقى عنده فد mild weakness between the attacks. يعني ما يرجع completely normal between the attacks. هذا اسمه relapsing remitting pattern. اكو pattern يبدي relapsing remitting وراه يصير progressive، يظل weakness ويزيد عنده، او يزيد عنده symptoms. النوع الثاني with time remission becomes incomplete and the disability accumulates، يسموه secondary progressive. واكو 10% of patients will display steadily progressive disability with the absence of relapse. This is called primary progressive multiple sclerosis. اللي راح يصير عندنا شنو؟ demyelination، حصلنا destruction بالمايلين، inflammatory plaques of demyelination in the CNS disseminated in space، يعني السايت يختلف، مكانات مختلفة، فيسموه disseminated in space and time. space يعني قصدهم المكان، السايت يختلف. demyelinating plaques تطلع في مكان معين، ورشات تطلع demyelinating أخرى في مكان آخر، ورشات demyelinating أخرى في مكان آخر. So they disseminate in time and place. demyelination. هو الباثولوجي شنو عندنا؟ هناك الديزيز الأول قلنا vascular problem سوت لي stroke، يعني مشكلة بالفيسلز سببت stroke. هنا بالمالتيبل سكلروسيس عندي demyelination سبب لي neurological symptoms، إما weakness أو paresthesia أو loss of bladder control أو visual problem happening شلون؟ over time and space، في أوقات مختلفة في مكانات مختلفة. They occur at multiple sites with more than 30 days between the attacks. 30 يوم لازم بين أتاك وأخرى. The exact cause of the disease remains unknown. It's most likely a combination of genetic and environmental factors. Mean age of onset is 30 years of age, female being affected more than male. How to diagnose it? MRI, plaque detection in the brain and spinal cord. So what's the most important test? MRI. ممكن طبعا نسوي CSF examination بس ما مطلوب من عندكم، انتوا قولوا بس MRI it's quite sensitive. أكثر من 95% من الكيسز 90 إلى 95% will be detected by MRI of the brain and spinal cord. As I said, the cause is unknown. There are many genetic factors, environmental factors playing role, and it is triggered by an immune mechanism directed against myelin antigen. عندنا مشكلة راح تسبب genetic factors, environmental factors راح تسبب this will cause an immunological trigger. An immunological trigger directed against the myelin antigens. Immunological trigger directed against myelin antigen. That's why treatment, steroids. There's no cure for multiple sclerosis. ما حد يطيب، ولكن نحاول نعالج السيمتومز ونحاول نبقي البيشنت symptom free as long as possible. وإذا صارت عنده أتاك نعالجها. إذا صارت عنده acute أتاك إحنا مو قلنا هي neurological symptoms مفصولة بالتايم بين مرة ومرة، من تجي neurological symptoms من تجي الأتاك نعطيه steroids أو نسوي لهم plasma pheresis to clear the antibodies from the patient's plasma. هذه for the acute attack. Corticosteroids and plasma pheresis. And the aim will be symptomatic treatment. إذا صار عنده motor involvement وصار عنده spasticity استخدم له باكلوفين. إذا صار عنده bladder dysfunction استخدم له أدوية للbladder dysfunction، وهكذا.